my name is Georgia Hatzidimitriadis. For my final presentation, I will be discussing minimally invasive varicose vein surgery. Along with the video, I will be posting a PowerPoint handout for everyone to follow through better. Varicose veins are dilated superficial veins of the lower extremities. These have troubled mankind for thousands of years and were known in ancient Egypt and ancient Greece. To better understand this disease, I am briefly going to discuss the anatomic considerations. Now, the lower extremities contain two venous systems. The deep system, which is represented by the dark blue, and the superficial system, which is represented by the light blue. Now, these two systems communicate by several perforator veins, which are represented by the red. Now, the blood flows from the superficial system to the deep system and then towards the heart. Now, these veins contain valves, and these valves help the blood flow in only one direction. When these valves start becoming incompetent, the blood backflows and varicose veins appear. The most common cause of varicose veins is prolonged standing. Some of the other common causes are deep vein thrombosis, pregnancy, trauma, obesity, and age. The symptoms can vary according to the severity of the disease. Some of the common symptoms are leg pain, itching, swelling, leg cramps, especially at night, and the feeling of heaviness. If the disease is left untreated, it will progress into ulcer formation. The treatment of varicose veins can be conservative with compression stockings or surgical. These here are compression stockings. They are elastic. They come in a variety of colors and sizes. The traditional surgical therapy has been vein ligation and stripping. Now, during this procedure, incisions are made at the groin and the ankle to find the greater saphenous vein, which is represented here by the light blue. Then a device called a stripper is passed through along its length. The stripper is then pulled and the vein is excised and removed from its location. This is a very effective technique, but it has been associated with severe pain and bruising. Over the last decade or so, new techniques for the treatment of varicose veins have been developed. The focus is now towards minimally invasive procedures. The two techniques I would like to discuss are endovenous laser therapy and radiofrequency ablation. The principle behind both techniques is the avoidance of large incisions in the groin and ankle areas. The greater saphenous vein is rendered non-functional but not removed. The advantages are quicker recovery, a lot less pain, and minimal bruising. What I would like to do next is to familiarize you with the equipment used in these techniques. I have several handouts which describe them in detail. What you will notice is that the two systems are almost identical. The difference lies in the technology used. These are technical details and are beyond the scope of this presentation. Here are the handouts that I will be discussing. Now, the first handout I will show you is about the laser generator. This provides the energy needed to rapidly heat the blood inside the vein, producing steam. The steam, along with direct heating of the vein wall, occludes and fibroses the vein. Next is the introducer kit. It has a needle and wire, which are used to cannulate the greater saphenous vein under ultrasound guidance. A sheath is then placed over the wire into the vein. All this is done with a tiny incision in the lower inner thigh. Next is the optical fiber. This is introduced into the greater saphenous vein via the sheath and positioned under ultrasound guidance. Note the special tip at the end of the optical fiber. I would like to show you now the equipment used for the radiofrequency procedure. Here is the generator, the introducer sheath, and the radiofrequency fiber. Now notice the similarities between the generator for the laser and the generator for the radiofrequency. Also, the similarities between the sheaths of the two. And then also the catheters. The catheters are also similar with the special end. The other important device used is the anesthesia pump. It provides local anesthesia along the course of the greater saphenous vein. This is important since the procedure is usually done under local anesthesia with the sedation. It also prevents burns, which can occur during the procedure. Now that you have seen the components, it is easier to understand the actual procedure. The patient is placed in the supine position. The greater saphenous vein is cannulated under ultrasound guidance, and the optical fiber is introduced. The vein is heated, it collapses, and it shuts. Once the diseased vein is closed, the blood is rerouted to the other healthy veins. At the end of the procedure, compression bandages are applied to the treated extremity, and the patient goes home. The next thing I'm going to discuss are the procedural highlights on this poster. The first one is the relief of symptoms. This occurs immediately after the operation. Imagine waking up not having the same leg pain, the swelling, and the heaviness that you had prior to the surgery. What a relief. The second one is this can be done as an outpatient procedure. Imagine what a relief it is for most patients when they find out that they don't have to spend a night in the hospital. With the vein ligation and the stripping, most patients have to stay in the hospital at least one day, and sometimes it can go to 3 days. For most and the pain still persisted after the operation. Next, it gives you the option if you would want local or general anesthesia. With vein ligation and stripping, the local anesthesia was not an option. Now, the patients, they don't have to go to sleep if they don't want to. Personally, I would want to have sedation, so I don't remember the surgical procedure. The next benefit is you can resume to your normal activities, typically within a day. With vein ligation and stripping, it was not uncommon to avoid activity up to 6 weeks. That meant that patients couldn't work, and which was not financially possible for a good number of them. Now, not only can you return to your daily activities immediately, but you can also walk out of the hospital after the procedure. The last one, which I think is most important for me and for most patients, is the good cosmetic outcome with minimal or no scarring, bruising, or swelling. With the vein ligation and the stripping, there were visible scars, especially in the ankle area, which the patient could not hide. Not only that, but the patient could also experience severe pain, which would make them very unhappy. To summarize, endovascular laser therapy and radiofrequency ablation are minimally invasive procedures used to treat varicose veins. They both offer several advantages over the traditional vein ligation and stripping technique. I believe the most important advantage is far superior cosmetic results achieved by these procedures. Thank you very much for your attention.